Hello, I'm Professor Richard Keane. I'm a consultant in metabolic bone disease working in London. And what I'm going to do is give you an oversight of some of the highlights from this year's ASBMR held in Vancouver. And I'm going to look at what some of the research that's been happening in the field of FOP and how this relates to clinical practice. So, at the meeting for such a rare disease, FOP had quite a high sort of exposure. There was a presentation at the Rare Disease Pre-Meeting Symposium. There was an industry-supported educational symposium, an oral presentation, and a number of poster presentations. So again, a lot of scientific interest in this disease area. So the industry-supported educational session was led by Mona Al-Makudum and Edna Mancia, who are both working at the University of Pennsylvania. And they went through the diagnosis of FOP, the challenges and the misdiagnoses that can occur, and stressed the importance of obviously the clinical examination of the shortening of the greater toe, but also highlighting the role for genetics in confirming the diagnosis. But they highlighted also the real sort of devastating nature of the disease over time and looking at the various manifestations both in childhood, adolescence, and then into adulthood. They also went over the current management of patients with FOP with regards to general disease care, but also looking at how you would manage disease flare-ups. And again, they drew attention to the ICC FOP clinical guidelines and the importance of these for clinicians in helping them manage these patients. And what we then saw from one of these sort of scientific abstracts was that there'd been sort of like a systematic literature review undertaken, looking at a large number of publications, and then sort of focusing on sort of ones where there was some really important clinical data. And I think what was really important from this sort of study was it highlighted that sort of although FOP is a condition causing the abnormalities with the heterotopic ossification, that there are sort of other body systems involved with regards to sort of hearing, with regards to cardiovascular complications, lung disease. And it was sort of just gave it a concept of the widespread nature of the disease. It looked at sort of the average age of patients being diagnosed, which we know is in childhood, and symptoms sort of starting around the neck. So it was just sort of looking at it from a wide literature base from across sort of the world, and again showing the common manifestations of the condition. Moving then to sort of the concept of the disease flare-ups, which we know are really important and are sort of, again, one of the classic hallmarks of the disease. And there were two sort of publications and abstracts that came from the Lumina 1 study, which is a placebo-controlled trial looking at garetosmab in the management of adults with FOP. And there were two, I think, really important, really quite interesting abstracts. One was looking at in the placebo arm of the study, so therefore this was when patients weren't on active treatment, and they were looking at the sort of the number of patients that were reporting flare-ups, but also then looking at how many of those flare-ups went on to develop actually heterotopic ossification. And there was really only a minority of those flare-ups where the actual disease was actually was then causing sort of heterotopic ossification. But what was also interesting was that even if someone was having a flare-up at one body part, they may then be getting ossification appearing on the whole body CT at another body region. So almost the flare-ups were more of a manifestation of overall disease severity, but also then that there wasn't a one-to-one correlation with where they were actually, where the heterotopic ossification would be forming. And from the same study, there was also some interesting data in sort of patient-reported flare-ups, again, from both the placebo and also from the garetosmab arm of the study. But again, it was just interesting looking at the types of symptoms that patients were reporting as a flare-up. And the most common were things regarding sort of reduced, was sort of like sort of warmth and swelling and pain. So again, just giving an idea of the type of symptoms a patient might be describing that would give rise to suspicion of a disease flare-up, and also just looking at the characteristic pattern or sort of degree of severity of those symptoms. And again, from the trial with garetosmab, there was a suggestion that it was shown that the the sort of patient-reported flare-ups were less severe in the patients who were receiving active treatment when compared to placebo. But again, I think just a really important thing, giving a concept of what the patients feel and describe as the symptoms of a disease flare-up. Another useful thing from the Lumina 1 study was looking at the type of imaging modality that could be useful primarily in research practice, but also could be thought of in clinical practice as well. And again, from the placebo-controlled part of the study, looking at baseline in 28 weeks, they were actually looking at basically both PET-CT and CT. And they were actually able to show that really the results from the CT showed pretty much a very similar performance to the PET-CT in the characteristic of both the presence of new lesions and also the volume of new heterotopic ossification. So that would suggest that, again, for future clinical trials, CT would probably be a better tool to be used for looking at the impact of the disease on individuals with FOP. And this obviously, we know that whole body CT is much more widely available than PET-CT, so basically opens up the studies to more sort of clinical sites, and therefore giving us access to a wider patient population. So another interesting abstract that was looking at sort of new imaging techniques in patients with FOP was some analysis from the data from the natural history study of FOP, which was looking at over 100 individuals with FOP and following them prospectively over a 3-year time period. And they were having whole body CT. But what the authors from this study did was they were basically using some novel software to basically look at the lumbar spine vertebral bodies, L1 and L2, and they were basically calculating bone mineral density of these vertebral bodies, and also looking at the bone volume and the bone mineral content. And what they were able to show was that basically the adult individuals aged over 18 had lower bone mineral density when compared to controls at these vertebral bodies, and that there was a sort of an improvement in these values in the children, which would be sort of expected given their growth, but there wasn't any normative data for the under 18, so we couldn't sort of compare exactly them to their age match controls. But the results did sort of suggest that that individuals with FOP probably do have lower bone mineral density, and obviously this would be something that I think going forward with both clinical trials, but also with general disease management, we need to be aware of that. And of course, there are lots of potential confounders. It could be that the patients, it could be steroid exposure. It could be related to immobility. So there's lots of factors that obviously could contribute to individuals with FOP having low bone mineral density. The authors also concluded that this technique using the CT scanning is actually quite novel. And again, we need probably more studies to look at sort of how robust and how relevant this is in patients with FOP, both treated and non-treated. And then I think what was really heartening was to sort of hear that there was quite a few ongoing clinical trials with FOP. There was an abstract sort of describing the design of the saracatinib clinical trial, which is a kinase inhibitor, which is being conducted in Europe. And then also at the pre-meeting symposium, there was a discussion about the other ongoing clinical trials that are happening with a number of drugs. I think one of the challenges, obviously, in this field is the rarity of the disease and the number of drug agents that are being evaluated. And again, the challenge is to try and identify these individuals with FOP and then sort of hopefully be able to offer them access to clinical trial, because then that would lead on to the development of and hope that the approval of newer drugs that will be effective for this patient population. So again, I hope that I've given you a flavour of the highlights of the meeting, the ongoing research that's happening, how this has relevance to the care of your patients at the moment. And again, I think with the ongoing trials that are happening, there is a bright future for individuals with FOP. So thank you very much.